Hello everyone, welcome back to the channel. Today we're going to talk about an important and potentially life-threatening condition called Diabetic Ketoacidosis, or DKA for short. Whether you're a nursing student, healthcare professional, or just curious about diabetes complications, this video will guide you through everything you need to know in simple, easy to understand terms. Let's start by defining what DKA is. Diabetic ketoacidosis is a serious complication of type 1 diabetes mellitus. It happens when the body does not have enough insulin, either because it's missing or severely inadequate. This causes three major problems in the body. There is hyperglycemia, which means very high blood sugar. There is also dehydration, which is as a result of excessive loss of water from the body. And the third one is electrolyte loss and acidosis. So this is as a result of chemical imbalances and acid build up in the blood. Think of insulin as a key that lets sugar into your cells for energy. Without insulin, sugar builds up in the blood, but cells starve for energy, and the body starts breaking down fat for fuel instead. There are three main reasons DKA develops. The first reason is decreased or missed insulin doses. For example, a patient might reduce insulin because they feel sick and eat less, but the body actually needs insulin even more during illness. The second reason is illness or infection. These stress the body and increase blood sugar needs. The third reason is undiagnosed or untreated diabetes. Sometimes people don't know they have diabetes until they get DKA. Other reasons for missing insulin includes errors like drawing up the wrong amount, skipping doses intentionally, or equipment issues like blocked insulin pump tubes. Let's now discuss the pathophysiology. So, when insulin is missing, two big things happen. Sugar cannot enter the cells, so blood glucose rises. This causes hyperglycemia. The liver makes even more glucose, adding to the problem. Since the blood sugar is so high, the kidneys try to get rid of the excess sugar by flushing it out in urine. But sugar pulls water with it, so the patient urinates a lot. This is called polyuria. As a result, they become very dehydrated and lose important salts like sodium and potassium. Now, because the cells are starved of sugar, the body breaks down fat for energy. This creates substances called ketone bodies, which are acidic. When these acids build up, the blood becomes too acidic, a state called metabolic acidosis. Let's look at the signs and symptoms. We have hyperglycemia, which causes polyuria and polydipsia. This occurs because sugar in the urine draws out water, leading to dehydration and thirst. There is also blurred vision, weakness, and headache. So high blood sugar changes the fluid balance in the eyes and brain cells, causing these symptoms. Another clinical manifestation is orthostatic hypotension. So this is due to loss of fluid volume from dehydration. The blood pressure falls on standing, which may cause dizziness. There is also ketosis and acidosis, which lead to nausea, vomiting, abdominal pain, and loss of appetite. So this occurs because acid buildup irritates the stomach and intestines. Another clinical manifestation is acetone breath, which is a fruity odor. So this occurs because the ketones are acidic and released in breath. Another sign and symptom is casmo respirations, which is very deep and rapid breathing. So this one occurs because the body tries to breathe off excess acid by blowing out carbon dioxide, which helps reduce acidity. The last clinical manifestation that we have is lethargy, confusion, or coma. So this occurs because there is severe dehydration and acidosis affecting the brain function. To confirm DKA, we need to check blood glucose, which is often very high, between 300 to 800 milligrams per deciliter. That is 16.6 to 44.4 millimoles per liter. We can also check the blood pH, which is usually low, indicating acidosis. We can also check for serum bicarbonate, which is also low, showing that there is metabolic acidosis. Lastly, we can check for the ketones in blood and urine, and it is usually elevated because of fat breakdown. The management of DKA focuses on three main goals: to correct dehydration, to restore electrolyte balance, and to reverse acidosis and control blood sugar. Let's discuss each of these. So our first goal was to correct dehydration. So since patients lose a lot of fluid through urine and vomiting, fluid replacement is critical. We give IV fluids, usually normal saline, 0.9% at about half to 1 liter per hour for 2 to 3 hours. After initial rehydration, hypotonic saline, which is 0.45%, may be used for patients with high blood pressure or sodium. When blood glucose drops to about 300 milligrams per deciliter, fluids with sugar like 5% dextrose in water are given to avoid sudden drops in blood glucose. Okay, so our second goal was to restore electrolyte balance. Now, electrolyte loss focuses on potassium. Potassium is key because it's lost in urine, but insulin treatment moves potassium back into cells, risking dangerously low potassium levels, which is hypokalemia. Potassium replacement is started carefully, usually 40 milliequivalent per hour. Even if blood potassium looks normal, we monitor the heart closely with ECG to watch for abnormal rhythms caused by potassium imbalance. Our last goal is to reverse acidosis and control blood sugar. To achieve this, we do a acidosis and insulin therapy. So insulin stops fat breakdown and ketone production. Insulin is given as a slow continuous IV infusion, usually about 5 units per hour. Blood sugar is checked hourly. When blood sugar reaches 250 to 300 milligrams per deciliter, dextrose is added to IV fluids to prevent a rapid drop. Insulin is continued until the patient's acidosis improves and they can eat normally. As nurses or caregivers, when it comes to nursing management, our roles include monitoring fluids and electrolytes closely, administering fluids and insulin on time, observing for signs of fluid overload, especially in older patients or those with heart or kidney problems, checking urine output to ensure kidneys are working before giving potassium, monitoring ECG for heart rhythm changes. Make sure that you document all vital signs, lab results, and treatments. Also, teach the patient and family how to prevent DKA from happening again. Okay, let's now test your knowledge. So I have some questions for you. Question 1 reads, what is the main cause of ketoacidosis in DKA? A. Excess insulin. B. Fat breakdown producing ketone bodies. C. Excess carbohydrates intake. D. Excess protein metabolism. You can pause the video and then answer. Alright, so the answer is B, okay, which is fat breakdown producing ketone bodies. So without insulin, the body breaks down fat for energy, producing acidic ketone bodies, causing ketoacidosis. I hope you got it right. Okay, question 2. Why do patients with DKA have a fruity smell on their breath? A. Because of high blood sugar. B. Because of acetone from ketone bodies. C. Because of dehydration. D. Because of vomiting. Again, pause the video and answer. Alright, so the correct answer is B, which is because of acetone from ketone bodies. So acetone is one of the ketone bodies and gives the characteristic fruity breath smell. Question 3. What electrolyte is most important to monitor and replace carefully in DKA management? A. Calcium. B. Sodium. C. Potassium. D. Magnesium. Pause the video. Find an answer. Okay, so the answer is C. Potassium. So potassium is lost in urine, but insulin shifts potassium into cells, risking hypokalemia, which can cause dangerous heart rhythms. Question 4. What is the purpose of Casmo respirations in DKA? A. To increase oxygen intake. B. To decrease blood sugar. C. To blow off carbon dioxide and reduce acidosis. D. To cause hyperventilation syndrome. Pause the video, find the answer. Okay, the answer is C. To blow off carbon dioxide and reduce acidosis. So, Casmo respirations help the body compensate for acidosis by removing carbon dioxide, a component of acid in the blood. Alright, so we've come to the end of the session. To wrap up, DKA is a dangerous but manageable complication of type 1 diabetes caused by insulin deficiency. It presents with high blood sugar, dehydration, electrolyte loss, and acidosis. So, prompt recognition and treatment with fluids, insulin, and careful electrolyte management can save lives. If you found this video helpful, please like, share, and subscribe for more clean nursing and medical content. Comment below if you have any questions or want a deeper dive into any part of this topic. Thanks for watching and stay healthy.